This is the new TC Pride Podcast, Episode 56, Part 3 of the 2016 Voices of Health Survey with Rainbow Health Initiative. The bisexual community in the snapshot of the results, there were some areas where they were sort of disproportionately represented. Maybe Dylan, you want to talk about that a little?
Yeah, I think our survey is consistent with a lot of national research that's both survey research and interview research that does show that the bisexual segment of the LGBTQ community often does have worse health outcomes, does experience a different type of discrimination. And I think a lot of that is both, from external heterosexual communities, general population, and also internal then from like the LGBTQ community as well. That we're still dealing with a lot of like bisexual erasure and biphobia within and without the LGBTQ community. And I think you do see that experience come out in the rates of outness to doctor, in the rates of experiencing homelessness, in the rates of smoking. And again, it's not that bisexual people in themselves are like more like, it's not the individual, it's the system that a person is in that is, causing stress in different ways, which we see kind of leading to different health outcomes than for lesbian and gay respondents. We see similar things for people that are, the way that we structure our survey is, we have lesbian, gay, bisexual, queer as sexual orientation options, but we also have, a write-in option. And so when we see a lot of folks identifying as like pansexual or asexual, we also see that folks that are identifying in those identity categories also are experiencing, higher rates of smoking and homelessness, having lower incomes. That's another thing we ask is income rate as well, which also can kind of give us a fuller picture of someone's lived experience. The other thing that I was going to say about our survey, and one of the valuable things about RHI collecting it, is that we are an LGBTQ organization, and sometimes people do feel more comfortable sharing about their sexual orientation and gender identity with an LGBTQ organization is a level of trust. We've been collecting data for a long time, and I think people know that we are out there collecting that. We're an LGBTQ organization doing work for LGBTQ people, and which I hope is makes people more likely to take our survey. It's also anonymous. We don't know who is taking the survey, so we can't come and like ask you questions later. So. Which hopefully also makes people feel a little bit more comfortable in sharing their experiences with us.
Can I build on that? Because that's such an important point about letting queer and trans folk lead. And one of the standards of inclusion is about hiring and retaining queer and trans employees at clinics, at state agencies, at federal agencies. One, because it demonstrates commitment. And it also acknowledges that there was a long time that the medical, health and human services sector was very discriminatory against queer and trans employees. But also, clients like to have the option of having a care provider who understands their lived experience. And those queer and trans employees should be at the forefront of policy development and program development because they're going to know the issues and the community better.
And Joann, so as a person in charge of sort of the whole range of services that RHI provides, what are some things that either you learned personally or things that maybe we didn't have time to discuss from the snapshot that you feel are especially important to share with folks in the broader community?
So a couple of things that really struck me this year. One was at the Opportunity Conference, when Dr. Gates was sharing some data with us. And because he has access to the Gallup data, he had a lot more in-depth information available. And so some of the things that he shared with us about the size of the bisexual community, and also about we talk a little bit about lumping the L and the G and the B and the T all together and kind of talking about them as a unit. And not only did he stress the need to separate each of those identities, but also to look at them by ages, because what they were finding in their data was that, in fact, millennial women were having much worse health outcomes than other age groups within the different identities. So that was really interesting to learn that kind of information. I think the other piece for me that really has struck me and stayed with me is the data that we had access to through the Minnesota Student Survey in 2013. And because for the first time they asked a question about sexual orientation. And so we had data available for lesbian, gay, bisexual, and questioning kids. And we knew that our kids were experiencing health disparities at high rates. But when Dylan was talking about the bisexual disparities for adults, and you look at the bisexual, particularly girls, rates for things like suicide ideation and suicide attempts, and some of the other health disparities that were disclosed in that data, at times you wonder how those kids survive. How did they get to be adults? And not only is that very upsetting to me, but it is horrific as a society to realize that that's what we do to our kids, and that we're not paying attention to that and creating the kind of change that needs to happen in order to create safer and healthier lives for our kids.
So I think, like you said, John, we could talk about this all day. There's so much. Who is you doing? Yeah, there's so much to talk about. I had some questions that we didn't even get to, but we should probably wrap here. I really want to thank you all for your time. But as we wrap here, are there any issues that maybe you just wanted to touch on quickly? Maybe Dylan, anything having to do with the survey? John, anything having to do with the education element of the program? Joann, anything else? We'll start with you, Dylan.
I was thinking when Joann was talking about Gary Gates's keynote, and it's a concept that I was introduced to by Dr. Lauren Beach about not having clumpy data. It's something that she is fond of saying is no clumpy data, which in this case means not lumping the LGBTQ community all together necessarily, and making sure that you're splitting out and looking at what's different between those different identities. And also, I think looking at making sure that we're looking at different racial categories across our data. And we ask about people's racial identities, and making sure that we're letting people bring their full self to our survey, and also to the table is also making sure that we're looking at what the experience is for LGBTQ people of color in Minnesota versus white LGBTQ people, and where that's the same and where that's different, and making sure that we're not silencing that part of people's lived experience, because it's just as important to achieving health equity, if not more important, since sometimes people will identify as their race before their sexual orientation or gender identity. And so making sure that we're keeping that in the forefront of when we're looking at our data and when we're looking at how we're using our data, so that we're not flattening people's experiences. And that's the only way that we're going to achieve health equity for all LGBTQ people and for all people, is if we're including all of the pieces of people's lives.
And John?
Specific to the education program, we're going to be launching this summer an e-learning module series that looks at intro to equity and inclusion for LGBTQ clients, collecting sexual orientation and gender identity, and implicit bias. So that's going to be really exciting, and it's going to be open to anybody that has internet access. So to put folks in Minnesota and around the world. But also I would say to folks that are listening to this, particularly if you are LGBTQ, I've had some medical issues in my life. And I thought, sometimes I was getting the care and I was realizing, maybe this was just me and my experience, right? And then as I grew into this work as an equity and inclusion education manager and working now for RHI, I'm beginning, really to realize that this is systemic. And if you are LGBTQ, please avail yourself of our resources, the provider directory, to find a culturally competent provider. The patient toolkit helps you navigate, how do I go to the first time with a provider? What do I say? If there's an issue, hopefully not, but if there's an issue that comes up, the patient toolkit provides some resources and recommendations on how to handle that. And find ways to invest in this work. RHI is really the only org in the state of Minnesota that is really looking at this from a holistic level of LGBTQ health. So any way that you can find to invest in this, because you're going to have to interact with the hospital system or a clinic or an urgent care at some point in your life. So please find a way to help us change that system.
And Joann?
So I can't not say something about the political environment. Not only are we going to be subjected to significant discrimination because of some of the executive orders and laws that are being considered and passed, we are being erased from the data. So the 2020 census had intended to ask sexual orientation questions, and now that has been removed from the census. There are two older American surveys. One of them includes people with disabilities that have already removed those questions from their surveys, and so we're being erased from the data. So if you, again, as I said, if you don't have the data, you can't claim that there's discrimination, and soon we won't have that data. And as I said, we are going with a new religious freedom executive order and legislation, not just at the federal level, but also at the state level, that's being introduced right now in Minnesota. We're really fortunate that we have a Democratic governor who is not going to pass that legislation, but that's not going to happen forever. And so we need to be active, we need to be politically active, and we need to ensure that our representatives, state and federal, know that we are committed and behind them and support them for the work that they're doing to make sure that we are not erased.
And Dylan, so Joann talked about the importance of everyone doing their part, and one of the easiest ways for people to do their part is to take the survey, right? Like I say, I've seen you out there, all summer, all over the state. Doing your thing, encouraging people to take the survey. It literally takes 5 minutes. It's just a handful of questions. So maybe you can tell people again where you'll be this summer. You also mentioned that it'll be available online, the 2017 version. Maybe as we wrap, you can just kind of talk about that just one more time a little bit.
Yeah, so we're collecting our 2017 Voices of Health survey at almost every Pride event. We'll be at Brainerd Pride, Pine City Pride, Golden Valley Pride. We'll be at Twin Cities Pride, Fargo-Moorhead Pride, Duluth Pride, Mankato Pride, and St. Cloud Pride. So if you're going to any of those, and Rochester Pride, So if you're coming to any of those events, come find the Rainbow Health Initiative booth, and we would be happy to give you a piece of rainbow swag in exchange for an anonymous survey. You can also take the survey online. It's not live yet. You can follow Rainbow Health Initiative on Facebook and find it there. Or you can check our website, rainbowhealth.org. It's not live yet, but will be soon. And again, if you're looking for something to do at Pride this summer and you want to help collect surveys, you can get in touch with me. Dylan.flunker@rainbowhealth.org.
Rainbow Health Initiative coming to a Pride near you. Thank you very much, all of you, for your time today and sharing this really valuable information with the community. And we hope to talk to each of you again soon. Thank you.
Thank you. Thank you very much.
Thanks.
Thank you.
The TC Pride Podcast is a production of Podletter Media and Twin Cities Pride. Subscribe now on iTunes, on Android, or on YouTube at tcpridepodcast.org.